Okay, so tell me kind of what this clinic offers, the services.
The services that this clinic offers is behavioral health services, which includes talk therapy, psychotherapy, grief counseling. Pretty much we are integrating behavioral health services into the primary care model. So we are addressing whatever need or problem that the patient presents with. A lot of times people are managing chronic illnesses, and the mind and body works together. So sometimes one thing affects the other. So a lot of times they will come in and they will address their medical issues, but they won't talk about the depression symptoms, anxiety symptoms, things like that. And so that's where the behavioral health consultants, come in. We talk with the patients, and then we get to the root of what's causing the blood pressure to be high, what's causing the stress. And we then will determine what the patient needs, try to set goals with the patient, see what the patient feels like they need, and then we discuss the treatment plan, and it involves sometimes ongoing therapy. There are times when we can meet with the patient and it can be resolved in a session or two, but then there's other times when it's something a little bit more complex that it requires ongoing treatment. Medication is another avenue that we explore, but the most important piece is the talk therapy, just being able to talk about it and get an understanding of what they're going through, how to cope with it, because some people choose not to use medication. There is no magic pill that that can treat mental illness, but there are medications that can help manage the symptoms. So what we try to do is educate the patients on what they're going through. Only a qualified mental health professional can diagnose, but we just try to explain and try to break the stigma and help normalize receiving behavioral health services.
So do you work with just students or the full community?
The full community.
Okay.
Mm-hmm. Here at Toulouse campus, students are able to come in, but they come in through the clinic. So basically community, we work with community individuals.
So we talked a lot about breaking the stigma. When you break your leg,
Mm-hmm.
you go and you get it fixed. I mean, you go to the doctor, you go to the hospital. So why is mental health different?
Why is mental health different? Well, a lot of times people are, they don't know they're suffering. They don't know they're ashamed to reach out for help. They don't understand it. Sometimes people don't even realize, they think it's just normal life. It's normal to go through stress. That varies across, cultures, as well. So people just don't like to talk about it, at times, or they don't know that they can talk about it. They don't know that they can ask for help. So some people see mental illness as a weakness. Mental illness is not, a weakness. Anyone can be affected by it. It can stem from genetics, stressful, traumatic events, brain chemistry. Sometimes there's no reason for it that we can explain, but some people just try to handle it on their own until it gets to a critical point. So we like to focus on being preventive. So we do screenings with each patient that's over 12 in our clinic and try to identify if the person is having some depression or anxiety and go from there. But I think being preventive and educating people is probably what's going to help people to feel more comfortable reaching out to receive the services.
Absolutely. So when you do these screenings, what are you looking for?
Basically, we're looking for symptoms. We are asking them in the past 2 weeks, have you experienced different symptoms, whether it be loss of interest in activities, feeling down, hopeless, or depressed, changes in appetite, changes in mood, have they been socially isolating themselves,